everyone, and welcome to the next webinar in our series, Person-Centred Care in Practice. My name's Anna Flynn, and I'm the Director of Partnering with Consumers at the Australian Commission on Safety and Quality in Healthcare. Before we start, I'd like to pay respect to the Gadigal people as the traditional custodians of country where the Commission's office is located. I extend that respect to all Aboriginal and Torres Strait Islander peoples and their deep time connections to land, water and sky. We at the Commission recognise that knowledge about healthy country, community and culture has been developed by Aboriginal and Torres Strait Islander people over tens of thousands of years and has been shared for generations. We are committed to partnering with and learning from Aboriginal and Torres Strait Islander peoples through the work that we do. Before I introduce our presentation today, and for anyone joining us for the first time, I'd like to remind everyone about our Person-Centred Care Resource Hub on our website, where you can find all things person-centred care, including information about our network, recordings of past webinars, case studies, and lots more. And don't forget to sign up to our Person-Centred Care Network to receive our Insights newsletter and keep up to date with person-centred care projects across Australia, as well as new resources and research. Our presentation today is from Metro South Health in Queensland. The team from Metro South will tell us about how they've redesigned their health complaints and complement service by ensuring that partnering with consumers is embedded within the clinical governance structure. This is an important consideration. As key elements of the National Safety and Quality Health Service standards, the Clinical Governance Standard, together with the Partnering with Consumers Standard, work to set the overarching requirements for the effective implementation of all of the other standards. Specific actions within the Clinical Governance Standard require health services to have an organisation-wide complaints management system and to seek regular feedback from patients, carers and families about their experiences and outcomes of care. There is also a requirement to use this information to improve safety and quality systems. The Partnering with Consumers Standard provides a useful tool in the Australian Charter of Healthcare Rights. This helps to guide patients and healthcare workers in regards to what people should expect when receiving healthcare. We'll hear more about how these actions can be effectively implemented in today's presentation. Just while we're talking about healthcare complaints, the Commission has recently released a number of resources on its website for clinicians and consumers to guide people through the process of making a healthcare complaint, as well as the responsibilities of health services and clinicians in managing complaints. Our presentation today will be followed by a live Q&A session with panel members. Please type any questions for the panel into the Q&A function. And at the end of the webinar, you'll also be sent a short survey and would love to hear your feedback. So without further ado, I'm delighted to be joined by the team at Metro South Health, who will talk to us about how they have redesigned their health complaints and complements process through their clinical governance structures. I'd like to welcome Anna Voloshenko, Jodie Nixon, Warren Stubbs, and Nicola Rogers. Over to you, Jodie.
We are very excited to be here today for this session of transforming healthcare complaints systems. Our team has no conflicts of interest to declare, and we'd like to begin their session by acknowledging the traditional custodians of the lands that we're on. And today we're recording from the lands of the Jagera and Turrbal peoples in southeast Queensland. I'd also like to pay my respects to the communities of Metro South, which we all serve. So that also includes the Yugambeh, the Quandamooka, the Turrbal and the Mununjali peoples. I'd like to recognise and pay respects to the traditional custodians of lands and waters, to elders past, present and emerging, and any people who might be with us today who identify as being from our wondrous First Nations culture. So, patients and consumers need to be at the centre of all approaches to quality and safety in healthcare. This is how we ensure all services will be person-centred. This session is a collaboration between staff and consumer partners to explore elements of safety and quality that have been developed and embedded over the last 4 years in Metro South Health. We will showcase how our consumer complaints and complement systems have developed to support person-centred care involvement. So there are 3 things we'd like to achieve during this session. Firstly is to understand the importance of strategic scaffolding to enable successful system development in consumer partnering and person-centred approaches. Secondly, we're going to learn about person-centred complaints and complement systems, and then have the opportunity to share experiences and generate new ideas to take back to your own health service. You're going to meet a few of us today. So firstly, in the first part, you'll meet myself, Jodie Nixon, as the Manager for Consumer Partnering at Metro South Health, and my comrade Warren Stubbs, who is one of our consumer partners. Then in the second session, you'll be meeting Nikki Rogers, who manages the complex complaints, and Anna Voloshenko, who is also a consumer partner. Consumer partnering can be messy and it can be complex. We've tried to reduce the messiness of our session. However, we also want to demonstrate that to be authentic connections, we have to sometimes get down and dirty and be a little bit messy. So to set the scene, I'm just going to show you a little bit about Metro South Health. So our region covers a land of over 360,000 square kilometres. There's an estimated 1.2 million residents, which is about 23% of the Queensland population. Our health service has 5 hospitals, 3 new health centres that opened last year, addiction and mental health services, and community and oral health services. The health service employs over 20,000 staff, and we currently have over 150 active consumer partners. Approximately 21% of our community speak a language other than English at home. Across the Metro South region, the top 5 non-English language groups are Chinese, Indo-Aryan, Vietnamese, Southeast Asian, and Korean. Approximately 20% of people identify as living with a disability. To build relationships with our community, we aim to feel that all people feel safe and welcome when they come to our services. Over the last 4 years, we have used a systems approach to methodically and sometimes chaotically build the capacity of our organisation and our consumers to partner effectively. There are 3 primary guiding frameworks that scaffold our organisation's direction and give us the power to influence change. This includes our legislative required consumer and community engagement strategy, our safety and quality strategy, and our national standards, Standard 2 Partnering with Consumers Action Plan. Using this systems approach has elevated, promoted, and improved the visibility of consumer partnering throughout the organisation. This influence enables us to continually ensure person-centred care is at the centre of all that we do. Our executive and leadership teams have supported and driven that we have consumer partners sitting on all national standard committees, both at the Metro South level, but also at the directorates. We also have consumer partners on all organisational strategic committees, such as our Disability Inclusion and Safety Committee, the Domestic and Family Violence Committee, Multicultural Committee, and our Elders Advisory Group. This representation ensures that consumers are active participants in the planning, design, delivery, measurement, and evaluation of our health services. The work from our consumer community engagement strategy, our safety and quality strategy, and our Standard 2 action plan and committee representation also leads to extensive consumer involvement in other areas of our health service. To ensure that our organisation meaningfully engages with our consumers, we have a dedicated consumer partner team that sits in the Metro South Clinical Governance Division, and each directorate has a person-centred care coordinator and a consumer liaison advisor team. These positions support consumer partners and staff to engage successfully, but are also involved in driving improvement projects. We have several systems that we have used and continue to develop over the last few years to make sure that the consumer voice is used across our health service and informs our continuous improvement. We have the Patient Experience Report Measure, which is an online survey offered to all people who have had inpatient admissions, emergency presentations, or outpatient appointments. This data gives us real-time feedback about how we are doing with overall care and helps us break down if people feel safe in our hospitals. In the last 3 years, Metro South has had over 27,000 responses to this survey. This patient experience data is used in all reporting to executive committees and the Health Service Board. In the last few months, this data has now been added to the executive accountability meetings, so needs to be reviewed on par with finance, staffing, and other resourcing. We also have a Best Practice Australia survey, which is conducted annually and gives us an indication of how we are tracking. This survey gives us great insights into our diverse areas, such as multicultural and disability groups. Additionally, we have a consumer complaints and complement systems that you're going to learn a bit more about in part 2 with Nikki and Anna. I'm now going to pass the baton to Warren to share his experience of the Consumer Partner Network and as a consumer in the governance structures and as members of committee executive meetings.
Metro South Health has a consumer partner network. We currently have over 150 formal consumer partners who partner across all areas of the organisation. The group get to meet with Metro South Health executive 4 times a year. Currently, we have a great diversity in our network with 14% from First Nations, 20% speak a language other than English at home, 20% care for children under the age of 18, and 30% identify as living with a disability. Our formal consumer partner group are consumers such as myself who have an ongoing relationship with our organisation. We all attend an orientation program where we learn about the organisation, including code of conduct, confidentiality, our values, and the exciting opportunities that await with the partnering ventures. This background understanding empowers us to have the confidence to engage as genuine partners. I'm going to share with you my reflections on some of my experiences as a consumer. With the transition to clinical governance, consumers were embedded in the decision-making tables. With this change, I had the benefit of influencing executive that consumer support staff and leadership were required and saw some staff becoming more aware of the importance and value of partnering. Consumers had to let the new structure develop and mature before we were able to see the real benefits and flow-on effect. I sit on the Metro South Executive Safety and Quality Committee and the Bayside Standard 1 Committee. I've transitioned from being a consumer partner to being an active member of these committees. Some of the things that I have influenced and changed include the development of an acronym sheet and instigated a deep dive into our previous complaint system. This was a compliance-driven system that met legal requirements. We were ticking the box, but not hearing the genuine voice of the patient or family member concerns. My involvement in the executive committees has influenced a full review of the complaint system, enhancements of the team with newly introduced clinical positions to meet the needs of the growing voice and complexity of consumers accessing our services. The new system is inclusive of all our community. At our last meeting in February of this year, the executive received training from Nikki in how to respond to complex ministerial and Office of the Health Ombudsman letters. The chief executive reiterated that we need to hear the genuine voice of concern from our community and respond with compassion and empathy. I always feel that I have respect from the committee and the executive. We have worked together to find better solutions. Our take-home message is that you need to ensure your organisation has a systems approach to partnering with consumers. This includes support documents, genuine partnerships with executive and consumers, and staff to support the programs. We are now handing over to Nikki and Anna to showcase the consumer complaints and compliment system that has been developed.
Thanks, Warren. So to give you the background that led to transforming our complaints and compliments system, Metro South decided to review our existing system in 2020. We knew from the outset that what we really wanted to do was make sure that we were hearing from the whole community that makes up the Metro South region. For this to happen, we needed a user-friendly system that made it as easy as possible for patients and their key support people to make a complaint or give a compliment and really match the diverse needs of our community in the way that we made the system available. As we started this project, which we call the Have Your Say project, we learned that our existing system wasn't particularly inviting because, as I mentioned, we're a really diverse health district of Queensland, but to make a complaint or give a compliment, you had to do so in English, and you could only do so via traditional methods like speaking to staff face-to-face or making a phone call, sending an email or a handwritten letter to our Consumer Complaints and Compliments unit. We also learnt from our PREMS data that Jodie touched on earlier that many consumers didn't actually know how to provide feedback to us when they were receiving care. At this point, we knew that to redesign a system that we hoped would maximise the voice of consumers, we needed to co-produce that same solution with those same consumers. So before I get into the details about how we did this, I'd just like to give some kudos to Dennis Morton and Angel Bugicevic, who were the project leads for this body of work and really brought the transformational energy to this space. Thanks to partnering with our people, we delivered a custom-built webpage through which consumers can make a complaint or give a compliment in multiple ways, and we redesigned the complaints and compliments form so that it was simplified and standardised across the district. But as many of you in the audience will know, meaningful consumer partnership can be tricky. You need the support of leadership, you need governance structures that effectively support and sustain you through not only development, but also implementation. You need a budget, you need the right consumers, and you need all of these factors whilst also managing the competing workload priorities that we all face every day. So how do we do it? To truly co-produce the outcomes, we started with a solid understanding of our community's demographic profile. We needed to know who it is that we serve. We then embedded their voice throughout the improvement cycle, not just in one aspect. I think there are many ways to effectively engage or partner with consumers, and each have their place and their strengths. So what we did was work smartly and brought multiple levels of engagement together in a way that made sense for the specifics of what we were trying to achieve with this redesign project. This included consulting extensively with both staff and consumers during the solution design phase of the project, which is usually the most straightforward example of partnering with consumers. In this aspect of engagement, we spoke with over 100 consumers one-to-one to deeply understand their needs. We were able to achieve this by using a staff member who was on light duties as part of a graduated return to work program. But our engagement also included having consumers as equal members on the project working group. This meant that when they were planning the project and when we were sifting and sorting through the results of the consultation, our discussions and understanding of what our people were trying to tell us was informed by consumers, not just staff. This brought a real richness to our discussions and decisions that could not have occurred with staff alone. And this inclusion could not have happened if our organisation had not embedded consumer partnering as our business as usual approach to clinical governance that Warren and Jodie mentioned earlier. And lastly, all project plans, updates, outcomes and endorsements went through our Metro South Executive Safety and Quality Committee that had consumers like Warren as equal members of the committee. This meant that when the project plans and budgets were discussed and endorsed, the consumer lens was once again part of those discussions and decision-making at the table. For me, this is really the goal of consumer partnering. It's not about throwing the baby out with the bathwater and having consumers make all decisions, nor is it about staff continuing to make decisions about what they think people in our care need, which has been the historical path. It's about bringing the perspective of both sides together at the table to come up with really well-considered solution that makes the best of our combined expertise. Because of our co-production approach, we were able to develop a gold standard user-friendly system, which you can now see playing on the screen. The system now allows consumers to type out their complaint or compliment or record it as an audio or video file. This means that regardless of someone's physical capability, literacy skills, or communication needs, their perspective can easily be shared with us. The webpage is also translated into our top 10 different languages, which allows consumers to read the instructions for the page in their own language. It also means that consumers can make a complaint or give a compliment in their preferred language, and we engage interpreter services like you would for any other health setting. Again, this means that people are supported to easily share their feedback with us, and our system is responsive to their individual needs and preferences. Later on in the complaints and compliments process, we then respond to the feedback in the consumer's preferred language as well. We also now have a simple co-designed and health literate form for consumers to fill out if they wish to provide written feedback that is consistent, no matter where they go in our health service to receive treatment. In the age of digital healthcare, this form redesign was really important to staying true to our diverse needs principle, introducing an electronic option, but also retaining a written option for consumers of all needs, ages, abilities, and preferences. And last but not least, Metro South now has unprecedented insight into the demographics of the consumers using our complaints and compliments system. So whilst we've been able to report on a consumer's Aboriginal or Torres Strait Islander status and preferred language in our risk reporting system for several years, we now also know that for submissions that are coming through the online portal, 1% of feedback was submitted by consumers who identify as non-binary, genderqueer, or another gender identity. 18% of feedback was submitted by people living with a disability, and 24% of feedback has been submitted by consumers who were born overseas.
For us consumers, being able to make a complaint or give a compliment in multiple ways means that all consumers are listened to, no matter who they are. All consumers are encouraged to provide feedback irrespective of their preferences and needs. This empowers consumers from all backgrounds and abilities to contribute. A greater diversity of perspective from consumers feeds into our service improvement initiatives, irrespective of their preferences, needs, backgrounds, and abilities. And ultimately, Metro South Health System facilitates person-centered care because the system itself is now person-centered at its core.
So what comes next? Metro South is seeking excellence in consumer experience. So for us, this means that we will work with others to provide the healthcare that people need. We will make sure our healthcare is safe and good quality, and we will ask people what they think about our care, and then we'll make it better based on the feedback shared with us. So this means our complaints and compliments system itself, the implementation of the system, the resourcing to run the system, and the workforce support to operate the system are critical to our organisation's strategic objectives. But as everyone in the audience knows well, effective implementation and sustaining project gains are probably the trickiest part of improvement work. This is where embedding consumer partnering as a business as usual approach in our clinical governance structures and supporting documents, cultivating those genuine partnerships between executive and consumers, and investing in staff to support partnering that Jodie and Warren mentioned earlier is really critical to this success. We've been ambitious in our to-do list, but I'm going to share a few specific steps that we've taken to implement and sustain the transformation of our complaint system. Firstly, we've introduced 2 clinical consumer liaison advisor positions, which manage not only our district's most complex clinical complaints, but also lead the strategic work we've set ourselves to achieve. Secondly, we've taken the time to formally evaluate the outcomes of the Have Your Say redesign project so that we can progress to the next iteration of the system. This evaluation has led us to updating and expanding our suite of supporting resources, which now includes a digital poster, a hard copy poster, a multilingual poster, a patient information leaflet, and a label for submission boxes if consumers choose to submit a hard copy form. We are complementing this with an implementation body of work that guides our district about how we display complaints and compliments forms and resources. It is great to have the resources that we do, but we want to make sure that we go the extra mile to display them in a cohesive, clear, and consistent way so it's really visible, accessible, and recognisable for consumers. I don't have a photo to share of these just yet, but we're hoping to do so in the near future. And lastly, we are tackling our approach to reporting complaints and compliments to try and really capitalise on the paradigm shift in our district towards curiosity about what our people are telling us is important, and that they are unique indicators of the safety and quality of how our health service is running. We've developed and endorsed an agreed set of key performance indicators with established methodology for each of those KPIs so that we can take the next step towards a robust, consistent reporting of complaints and compliments. And to do this, we really wanted to make sure that through our approach to reporting, we are promoting a reporting culture. We are able to hear about the safety of our system from the consumer perspective. We are getting a contextualized, aggregated picture of patient experience, and we are then able to use complaints and compliments as a real driver towards improvement. So at present, we are building a custom dashboard to enable reporting of these agreed key performance indicators and hope to have it fully implemented by the end of this year.
The key learnings that we would like to take away from sharing our journey are: person-centered care needs the systems underpinning care to be person-centered. Consumer partnering needs to be embedded in your organization's clinical governance structures to enable successful project development and implementation. Consumers need to be involved in all aspects of development and design of projects to maximize the mutual benefit of consumer partnering. Meaningful consumer partnership requires effort, time, and resources, but it is necessary for the best possible results. Closing the loop with consumers is essential, especially in redesign projects. Making our system inclusive is challenging, but it makes a significant impact for patients and the care support people in our care. As a Metro South Health consumer partner of 10 years, I have seen many changes and never imagined that the system would provide an opportunity for consumers to sit on committees and be part of the planning, design, delivery, measurement, evaluation, and most important, decision-making process, thus contributing their thoughts and perspectives towards the improvement of healthcare services and support person-centered care. Our successful redesign of compliments and complaints has opened doors to strive towards other improvements, which will benefit both consumers and Metro South Health healthcare system in years to come. And it is because we are better together. So thank you for listening, and we look forward to your questions.
Thank you, Anna. And I'd now like to welcome the team from Metro South who are here to take your questions. Thank you so much for that presentation. We've been doing some work at the Commission on healthcare complaints as well, and it's really beneficial to be able to see in practice how you can actually embed that process within your clinical governance structures to really bring about that level of accountability. Now, I have a question. I think Jody, probably I'll direct this one to you. But one of the things that people have told us when we've been asking them about healthcare complaints is that that really the reason they make the complaint is because they're actually wanting to ensure that something is changed and that something doesn't happen to someone else that might have happened to them. I'm just wondering, are you able to actually close the loop and be able to provide that level of feedback to the people that make those complaints?
Absolutely. And I will answer that, but can I also just apologize? My typing is terrible and my spelling is terrible. So when I've been responding, there's multiple spelling mistakes in there. Please forgive me for that, everyone. Now back to your question. So we really try and make sure we've embedded that in the process. So the expectation is everybody who puts in a complaint will get firstly an acknowledgement phone call, if at all possible, but we also will then go back to people with a summary of that. So we really try and give them a response to their individual complaint, but we also really want to try and make it bigger and look at the changes that they can make. So an example, recently a complainant touched base with us about 3 weeks ago around the wait time in emergency department, which I'm sure lots of people on Wellline will also have had that experience. We were able to resolve the complainant after we went through the investigation, apologised authentically for their their experience and gave them that really relevant information to their presentation. But additionally, what we were able to do with that is we've got significant expansion work going on across Metro South. So we were able to let them know as a medium term to improve patient flow that we had opened additional 12 beds in that particular area. So we really try and make sure we answer their complaint, but then let them know about those bigger picture things that we're doing so they can understand we are really trying to authentically make it a better experience for other people. Yeah.
Excellent. And so I guess that then becomes a conversation as well, where you can potentially engage them again in future work.
Absolutely. And we do have some of our complainants who do go on and become consumer partners with us down the track. Yeah.
Great. Thanks, Jodie. And Nicola, are you able to provide any examples? Well, Jodie just provided one there, but can you provide any examples of when some feedback, complaint or compliment has directly resulted in an actual system or process change?
Yeah, absolutely we can. Look, we're big on tangible examples here, clearly. So probably the one that comes to mind for us as a group is last year we handled a complaint that really highlighted an opportunity that we had, not just in Metro South, but across the state of Queensland, to update our system so that they accurately and reliably reflected some of the demographic data for our patients. So in this circumstance, it was a patient from the LGBTQIA community, and as we investigated the complaint, we also realised that this had implications for anyone who might have a change in their name or a gender that's different to their sex assigned at birth. So marriage, civil partnership, adoption, by application, there was lots of different cohorts that this might impact. So statewide work is already in progress in Queensland, but this particular complaint highlighted how further change beyond what was already planned was needed to truly prevent recurrence of this experience. So the outcome is still in progress at the moment, but what we've been able to do once we've identified the case is really use it as a concrete example to escalate to the statewide teams. It's really real world and tangible for them to show why the further refinement than beyond what they had planned was needed, and the cohorts that it would impact, because it really is a truly preventable poor experience. So we're hopeful, outcome's not there yet, but hopeful that this will result in a system change so that the system becomes more person-centred, like what we've found through our complaint system the system itself becomes more person-centred.
That's brilliant. Thank you. Warren, so it would seem that obtaining and listening to feedback is part of the culture at Metro South. Are you able to talk to us about how you've managed to get to this point? And have you been able to actually demonstrate the value of complaints in the system?
Yes, thank you for that opportunity. When we were discussing right at the beginning at the Executive Safety and Quality about governance issues around complaints, I was then able to bring into the discussion being able to introduce a standard 2 flavour into a standard 1 content.
Yeah.
And talk about the need for the type of resourcing that we need to make that happen, and for the not only the resourcing, but where that resource sits. So it's in part of the consumer partnering. So yes, we were able to solve a governance issue and a standard 1 issue, but we also created that standard 2 flavour that brought the process to genuine consumer focus. And just re-emphasising what was said previously, in our recent training, and imagine with a room full of decision-making executives being trained by Nikki on what should be in the content back to the patient, and the chief executive expressing, we need to know what their real concerns are. We need to have listened to them, not just comply by sending a letter back. That's the culture now that's leading by example. And so that allows those changes in partnership between the governance and the consumer partnering to make a big difference. And I was sitting in that meeting and allowing that to participate.
Thanks, Warren. And there's a similar question online in terms of how do you support the consumers that are in these governance structures to feel like you do, empowered to be able to speak up and to be part of that system?
By we have 4 times a year a consumer partnering get together where we help and share. So a live example, a consumer that had never recently arrived in Australia, who had never been on a recruitment committee, companioned with me, and the executive gave permission for that individual to be with me and to learn from that experience. That consumer representative has gone on to actually present and co-chair and be part of a committee.
Fantastic. That's great. Thank you, Warren. Jody, one of the things that we've talked about in these webinars before, it often comes up as an issue, is how do you reflect the diversity of the community? I think Warren touched on it there, but how do you identify and engage a diverse group of consumer representatives? And have you worked with specific community groups to encourage people to get involved?
Yeah, absolutely. So I think the first thing that I think is really essential is that you actually need to understand who your consumer demographic profile is. And you would have seen on our second slide that we always do that, and we try and put that into any meetings or occasions as much as possible to really reinforce who actually is the community that we're serving. And we regularly review that and update that to changing demographics. What we also then do, there's no one answer to this. It's got to be multiple different things. So firstly, there's word of mouth. So consumers talk to their friends and their community and bring people on. We get some through, like we said before, the complaints process. But then we also go out specifically to community groups. And that's not just the consumer partnering team. We have a health equity and access team as well. So we will go out to specific community groups or non-government organisations as well to make sure we really get that diverse representation. And we're really proud, and you again would have seen that slide that Warren showed with the different consumer partners. We've got our diversity does reflect our community, and we also make sure that we don't just assume consumers want to sit on committees, because that can be pretty dry also. So we really make sure we have lots of different engagement forums that people can engage in a way that suits them.
That's great. Thank you, Jody. Anna, it's fantastic that the complaints page is available in 10 commonly spoken languages. What do you do if someone's language isn't available? Do you have a process where you can provide interpreters?
Yes, we do. The important thing to realise, though, that Metro South Health as such has roughly over 200 different languages, and some of them are dialects, which means that they are not written, and that complicates matters. And the other important thing is that culture and spirituality influences in many, many ways the way that people view and respond to health and disease discussions about things like complaints and compliments. Hence, it's already been mentioned that our forms, which are translated into 10 most common languages that are spoken, have saying, well, have you say, rather than tell us what was good or bad. By having the have you say title, it means that it opens an opportunity for people to say what was good, what wasn't so good, and what could be improved. So that is important. But to answer your question, if we receive a feedback in other languages, we simply engage an interpreter to tell us what it is that is needed, and then the response is given in the language as well. And of course, when there is something that is difficult to translate, because some languages do not have an equivalent terminology, it's also dealt with in that sort of way. But just recently, we added another 2 languages, Burmese and Hazaragi, to our pool of resources because that seems to be the one that is coming very common. And as Jody said, we do have that demographic information, so we can tell people and somehow get together and organize the translation of those kind of languages which are not available. We also simplified the resources so they're in plain English. That can be read by some people from culturally diverse backgrounds, but it's also a lot easier to translate into another language. And that way, we are not missing out on any of the information that we need. But it is a complex issue, and it's with 21% of people who are not born in speak another language. Well, it is quite a sizable population.
Yeah, that's great. And this might be one more for Jody, but have you noticed a marked improvement or increase, sorry, in the amount of feedback that you're actually receiving from a mixture of diverse communities or community groups?
Might pass that one to Nikki.
Okay.
She's more over the stats of that.
Yeah, that would be. We don't need the exact stats, but I'm just wondering. It's one of those occasions where sometimes there's a presumption that there's no feedback from the community because it's not been received, and it's just interesting when you provide that option and you actually promote it and you actively seek it. I'm wondering if you've actually seen a big increase in the feedback.
Thanks, Anna. I'll take that one. So, look, in terms of uptake, the uptake hasn't been huge, but we're just mindful that we've got a couple of different compounding variables. So, as most people know, like complaints are increasing statewide, nationally, and internationally. So we'd probably have to do a bit more rigorous analysis to be really confident of our findings about whether the accessibility measured was correlated with any increases. And I guess the other tricky thing is that whilst we can keep track of the submissions that people enter, we can't actually track when someone changes the web page into their preferred language. We can't actually track that. So it's also quite possible that people are perhaps reading the information in their first language, but choosing to then express themselves in English because that's their choice. So that bit we can't track. And the other one, we've probably got too many confounding variables for a less rigorous analysis. But certainly the people who have used it have, I guess, spoken about how important it was for them to be able to use it if they needed it. Not everyone's going to need it, but having it there means the people who do need it can use it if that's what the best fit for them is. And it's really about meeting them where they're at.
Yeah, definitely. And probably Jody or Nicola, when you're reporting this and reporting it back up through clinical governance processes, are you able to merge the different sort of feedback, or is it still in sort of the separate sort of PREMS, compliments, complaints? Is there any way you can bring it all together to reflect an overall picture?
I would love to say to you, we've nailed it, but it's a work in progress. So we work closely with our patient outcome measurement evaluation team, and we've really been working on the last few years of really trying to triangulate patient experience, compliments and complaints, clinical incidents. But the other thing we do, particularly with our PREMS data, we also match it in with our other auditing process. So an example of that is like with our informed consent. So we look at are we meeting our documentation requirements? Are patients saying they're getting what they need for that? Are people feeling they've gone away and been given the information they needed to ongo with their care? So I would say we're working at triangulating that, but have we got that system squared away? Not yet. Yeah. And I think somebody put something in the chat about how do you do that. But I think the first thing is to make sure you start combining those data sources. So to start with, we used to have just a standard 2 report where all the PREMS information went into that. And we've since realized that that's not helpful to anyone. So we now build it into the different reporting and the questions that make sense go into that.
Excellent. Okay, and there was a question in the chat as well about from the national standards perspective, how this fits in and if it's accredited. So there are, I think we touched on them at the beginning of the presentation, there are 2 actions in the national standards that look specifically at healthcare complaints. They are quite broad, though. They look very much at whether there's a mechanism, and it doesn't really delve into the detail of this sort of quality improvement and how that's reported. So I think that will be a good area for us to be looking at as we move towards the development of the 3rd standards, which we're starting to undertake at the moment. Quick plug for that. Another question, moving to the complements. Whilst you were presenting, I was thinking it's not often we touch on the complements and the impact that they can have. But I'm just wondering how is that relayed to your staff? And do you think that it results in improvements in morale?
Yeah, I'm happy to take that one. I think you're spot on, Anna. We know that from like a safety 2 approach, looking at complements is just as important as doing large-scale analysis of complaints, because both tell us what our people are thinking and feeling and how our systems are operating. So usual business for us is for any compliment that comes in, firstly, we share it with the respective team. We really want to reinforce that positive message and positive behaviour. And like you said, boost morale. Healthcare is not an easy job. It's not something you can take lightly. It's got significant consequences. So we really want people to know when the community is expressing their approval for it. And then more broadly, like Jodie mentioned, we're a pretty big health service. So we've got some big hospitals, we've got community health centres. There's lots of different pieces. So there is a little bit of variability in what makes sense about how to distribute that. But a couple of examples of what different areas do. We've got one really big hospital that sends like a daily compliments to each of the divisional directors so that they can share with their team. We've got another one of our smaller hospitals or medium-sized hospitals puts a de-identified example in their staff newsletter. So the bulletins that go out always start with that positive affirmation for staff. And then one of our smaller hospitals actually invites areas that are doing really well in their compliments to come and speak at forums, so that other areas who are also at the forums can then learn from that and take the translatable or transferable lessons from it to their areas. So bit of variability, but it gets it out in a wide way.
Yeah, that's great. You may have touched on this, but once the complaints are closed, do you ever go back to the people or compliments to check in and see how they felt about the process?
Yeah, I'm going to mimic Jodie here and say we haven't got this one quite squared away yet, but it's certainly on our radar. So like I mentioned, we've set ourselves quite an ambitious to-do list. Part of when we redesigned the complaint system, we then did a 2-year evaluation of the program, and then that coincided with 6 months after that, we did a comprehensive update of our procedure. Quick plug for the Commission, we plugged the checklist for practitioners that the AHPRA and the Commission have put together. That's now embedded in our procedure, and we're just coming up to our evaluation of the procedure. So one of the things that we've identified is we won't be able to do it for this evaluation of the procedure, but next time we really would like to start collecting some of the experience data of people using our complaint system to help inform what we're doing. But we haven't got it squared away yet, but it's certainly on our radar.
That's great. Thank you. And I'd like to go back to the consumers, Anna and Warren. Sorry, I used the word consumer, and I know that's not a popular word to use. So we're seeking your feedback as well on better terms. Anna, what are the lessons you've learned as part of the work that you've been doing, and what's on your to-do list? What would you like to see happen?
Sorry about that. Well, I was really very surprised, having been around other health services, how Metro South have embraced the opinion of consumers and also take some measure in order to help and change some of the things which were not up to scratch. Now, my particular work in Metro South involved culturally diverse communities. And from that point of view, it was interesting to hear that those communities never really wanted to complain or do any other types of comments that might have been relevant because they were afraid of retribution. The other important thing was that they said that whatever it is that they were getting at Metro South Health was 1,000 times better than what they would have had done at home. So it just might have spurred some of the comments further. And this is why our team is looking at making health and services that are provided by Metro South equitable as much as possible, and not just to culturally diverse, but you know the disabled and LGBTQI teams, big one, because of refugees and the way that they came to this country, etc. But lessons learned, I guess, is that I think for the health system to improve, they need to listen to the ones that they serve, not the other way around. And that is such a difficult area because it has not happened before. And perhaps some people are not used to be questioned or asked about certain things, but it is important. And this is how health will improve. And this is how healthcare will thrive, because they will know what it is that they need to do for different types of people and their different types of needs and preferences.
Such good insights. Thank you, Anna. Warren, how about your journey? Any lessons learned, and what are your ambitions for the future?
Yes, you have to reflect upon the past sometimes to see where you've gone or how far you've come. And going from being the only consumer at Bayside as the co-chair of the only standard committee who helped introduce compliments and brought a standing agenda item for complaints to be brought into that committee, to now sitting on the Executive Safety and Quality. And yes, Jody and Nikki have mentioned items that are still being developed, but as a member of that committee, we expect that progress to happen, and it's on the agenda for it to come back. So, you know, measured performance improves. And so going from 150 consumers and sitting now with decision makers from one consumer sitting at a small hospital on my own, and we're never on our own. We always have a minimum of 2 consumers. We're always focused and genuine about what we do. And we're now working with the executive and the national standards, because all 3 of them help us walk up that very steep sand dune.
Yeah,
And we're not stopping.
you're doing a great job. Jody, any final comments from you in terms of lessons learned, particularly around how you've brought the complaints and complement system into clinical governance, and what your plans are going forward?
Yeah, probably what I would say, we actually published a paper late last year in Health Expectations around embedding consumer partnering into clinical governance. And we've tried to make it a very friendly publication. So in there's 5 enablers and 5 barriers. What I would say to people is you've got to have executive support. For change to happen, your executive have to believe in it, have to support it. They don't necessarily have to drive it, because they've got people like Warren, Anna, myself, and Nikki. We'll drive it, but you do need the executive support. So I would say if this is a newer area for you, make sure you keep showcasing wherever you get the opportunity, so that you get that executive on board. Our next plan is really trying to improve our data and making sure that the data we get is good data, so that we can then use that to drive improvement as well. And we're in the process of getting a wonderful new dashboard built, but we've really done an extensive consultation about what in that is going to be usable to drive improvement. So they're probably our big things that we want to head for in the next little period of time.
Fantastic. Well, time's drawing to a close, but I would really just like to thank you all for being part of this webinar today. It's fantastic to hear such a positive approach to how you're managing what can be a very difficult process to manage, and it's really nice to have heard from all of you. Thank you, Warren and Anna, for your time today. So I'd like to thank the team at Metro South. We really appreciate all of your time in presenting for us today. Keep an eye out for our call for content for our next Person-Centred Care Insights newsletter. If anyone else watching wants to present, then we're very happy to hear from you. If you sign up to that newsletter, it's on our website. We can also include a copy of that Health Expectations journal that you mentioned, Jodie. So if that's okay with you, we can send that out to everybody through that newsletter. Another quick plug, just to remember, the Commission did develop some resources on healthcare complaints. So we've got 3 animations and the checklist that Nikki mentioned before, checklist for practitioners. They're really developed to help guide consumers and health services in the process of making a healthcare complaint, and where to go if you're not happy with the response that you receive from the health service. And I'm looking forward to seeing everybody next time. So thank you all for joining us today.